Please welcome John Feinblatt, President, Everytown for Gun Safety, and Dr. Annie Andrews, pediatrician at the Children's National Medical Center, CEO and founder of Their Future, Our Vote, and senior advisor at Everytown for Gun Safety.
Annie, let's get right into it.
Sounds great.
So when Mike Bloomberg and I started working on the issue of guns, we really thought of this as a public safety issue, and that was natural. Mike came into office right after 9/11, and he wanted to make sure that people thought that New York was a place to live, to visit, and to invest. But one thing about Mike is he follows the data, and it became pretty clear that this was not just a public safety issue, it was a public health issue. And in fact, by 2020, if I'm right, guns became the leading cause of death for children and teens. And so the obvious question, Annie, is how do you mobilize the medical profession, particularly doctors, to work on this as they've worked on other public health issues like tobacco? So Annie, you're a doctor. Take us inside hospitals, take us inside of doctors' offices, and tell us how this issue is dealt with.
Sure. So when I became a pediatrician, when I decided to become a pediatrician, I envisioned a career caring for children with asthma, pneumonia, diabetes, and seizure disorders, and broken bones. I never imagined I would care for so many children who had been shot. But as you just said, gun violence is now the leading cause of death for children in this country, and this is a pervasive public health crisis. So you would be hard-pressed to find a physician practicing in any subspecialty that doesn't walk around with the haunting memories of standing at the bedside of patients who have been shot. For me, I will always remember a sweet 4-year-old boy who found an unsecured firearm on his coffee table, and as curious children do, he picked it up, unintentionally pulled the trigger, and shot himself in the head. By the time I met him, he had had multiple neurosurgical procedures. Part of his skull had been removed. He had to wear a helmet. He was in the hospital for months learning how to walk again, learning how to talk again, and learning how to feed himself again. And every child I've cared for who has been shot is a tragedy. And what keeps me going in this work is the fact that these are preventable tragedies.
So those are heartbreaking stories, and it would seem obvious that doctors should be part of solving this crisis. But there's a problem. And the problem is that this issue has become so politicized. And when I say that, that's probably an understatement. Mm-hmm. And I think that one of the issues becomes doctors feel like there are political tripwires everywhere they step when it comes to the issue of guns. So about almost a year ago, I said to Annie, I remember when my kids went to the pediatrician and we learned about seatbelts and we learned about helmets when the kids started to ride a bike, and we learned about how to secure the car seat. And so I asked Annie a simple question. How do we make talking about gun safety as simple and as straightforward as talking about seatbelts?
And that should be an easier question to answer, but we have learned that it is not. I think first I'd say that physicians in training, medical students, and practicing physicians are all eager to be a part of the solution to this public health crisis. We just have to provide them with the tools to do so. So about a year ago, I essentially went on a listening tour talking to anyone and everyone I could find in the healthcare sector who was engaged on the issue of secure firearm storage counseling, because that is a very clear, effective, cost-effective public health intervention to reduce the incidence of pediatric firearm injuries and deaths. And I stumbled upon, after talking to some of my colleagues at Cincinnati Children's, this incredibly innovative, scalable, standardized tool to provide education and a chance to practice skills for medical students across the country in partnership with the Mass Gen Center for Gun Violence Prevention under the umbrella of the New England Journal of Medicine. So I'm thrilled about the work that we're launching just next month, January 2025, at 10 of the top medical schools in the country, where we will be piloting this program to educate one-on-one medical students how to have nuanced conversations about secure firearm storage with patients and patients' families across the age spectrum and across the clinical spectrum. Because no matter what subspecialty a physician is practicing in, whether it's pediatrics, family medicine, psychiatry, trauma surgery, emergency medicine, this issue is so pervasive that it touches all of our fields. So we're going to be training a generation of new physicians how to have these conversations so that it is normalized, institutionalized, and standardized, just like it is to talk to families about the importance of bike helmets.
And I think it's important, Annie, to remember, we're not talking people into having guns or out of having guns. What we're talking about is safety.
That's right. Right. And I think what is so encouraging about this program that Everytown is supporting is that in the current political landscape, this is something that we can all feel really comfortable doing. This is a proven public health intervention that is completely separate from the politics of gun ownership and gun violence in this country. And I believe that's why medical students are so eager to do this, because it doesn't take you long when you're working in a hospital as a third-year medical student to stumble upon your first patient who has been shot. And as I said earlier, those situations are haunting, and we carry those around with us for our entire career. So of course, physicians are looking for solutions, and I'm just so excited that we can provide them, because this is how we change the culture in medicine. It's easier said than done. Changing physician behavior is challenging, but when we use these scalable, standardized, innovative approaches, we can accomplish just that.
And if I'm right, for a hospital to participate, there's one requirement, that every medical student has to participate.
That's right. And so we're rolling it out in these 10 medical schools, including Hopkins, and 4 historically Black medical colleges starting next month. And we are asking the schools to commit to requiring one class of medical students to do this. So this is a 24-month pilot project that I know will continue to grow. We already have a waiting list of 10 other medical schools who are eager to have their students gain this knowledge and skill set.
Annie, it is so encouraging to work with you and to know that what we're really doing is building a new generation of doctors who are going to see the issue of gun safety no differently than they see safety, seat belts, helmets, or the detergent under the sink, which was always the one that was hard for me because I never could unlock the safety lock that I put on it. Thank you very much.
Thank you so much, John.